Antibody-directed enzyme prodrug therapy, or ADEPT, is a groundbreaking technology for cancer treatment. So, what is ADEPT? ADEPT is a unique therapy designed to specifically target tumor or cancer cells. To explain this simply, let's walk through the acronym ADEPT.
AD, antibody-directed. An antibody is a protein manufactured by our bodies to target foreign antigen that could be potential threats. Scientists work to design specific antibodies to target tumor cell antigens. So, these special antibodies are linked to an enzyme that will be directed to antigens on tumor cell surfaces. You can think of antibody as a magnet that is attracted to tumor cells.
E. Enzyme. An enzyme is a protein that catalyzes specific reactions within the body. The enzyme conjugated to the antibody must not be an endogenous human enzyme. The unique enzymes chosen in ADEPT are capable of converting a prodrug into an active drug. You can imagine the enzyme attached to the antibody as a pair of scissors that can liberate the prodrug or medicine. E. Prodrug. A prodrug is an inactive drug activated only by a specific enzyme. Until the prodrug contacts the enzyme, it is inert, or essentially restricted and unable to perform its medicinal purpose. E. Therapy. And with all these components combined, they can be used as a therapy to treat cancer with high specificity. In this tutorial, we will explain the mechanism and advantages to this revolutionary technology. Roghiye here is representing the antibody enzyme complex. In his right hand is the antibody, or cancer magnet. In his left hand is the enzyme, or scissors, which act to cleave the prodrug. Roghiye is our prodrug, which upon hydrolysis by the enzyme, or cutting of her hand restraints, is liberated into the active form of the drug. Imagine that this hallway represents the body, and the blue chairs represent healthy, functional cells. The cancer cell is represented by the green chair. Our antibody enzyme complex, in this case, the magnet and scissors, is administered to the body and binds to antigens located on the surface of cancer cells. After a sufficient amount of time has passed, the prodrug is introduced to the body. The enzyme, or scissors, cleave the prodrug moiety, converting it to the active drug in close proximity to the cancer cell. In this example, CMDA is our prodrug of interest. Once in the active site of the non-human enzyme, carboxypeptidase G2, CMDA is cleaved by hydrolysis into the active drug and glutamate. The active drug is a cytotoxic reagent that will destroy cancer cells. The drug is then able to fulfill its task and destroy the cancer cell.
One of the factors to consider when utilizing this therapy is the amount of time allotted between administering the antibody enzyme complex and the prodrug. If not enough time is given for the antibody to find the cancer cell, then this will result in the activation of prodrug in an undesirable location, resulting in damaging healthy cells. ADEPT has the potential to treat any cancer type, given that the antibody is an adaptable component of the system to target any tumor. This treatment could have powerful impacts on the lives of cancer patients, with its reduced side effects and wide range of applications. Due to high specificity, ADEPT is a less toxic cancer treatment when compared to other options.